Hi everyone. Welcome to RSB Healthcare Consulting. 5 tips to avoid CMS audits. Prevent billing and coding mistakes. As a physician, payers trust you to provide medically necessary, cost-effective, quality care. You exert significant influence over what services your patients get. You control the documentation describing services they receive, and your documentation serves as the basis for claims you submit. Generally, Medicare pays claims based solely on your representations in the claims documents. Coding facilitates the billing process by bringing uniformity to the procedures through recognizable codes. Using standard diagnosis codes and procedure codes, the medical coder ensures that Medicare will recognize the billed item and how the diagnosis warrants that procedure, test, or treatment. When the coding on the claim does not meet the Medicare requirements and Medicare pays the claim anyway, the audit may discover this mistake. To prevent coding mistakes, make sure the most current coding books are on hand and use appropriate modifiers according to Medicare guidelines. Provide accurate documentation when in doubt. Document. Because there are multiple systems that could be involved in an audit, medical organizations need to make sure that everything is documented. This includes data presented on meaningful use reports generated by EHR and all other evidence. This is important for researching during or after an audit and for justifying moves that have been made after the fact. Companies that have the proper documentation of every decision made and each process change will be able to easily find any potential trouble areas and address processes that are pointed out after an audit. Auditors will be looking for discrepancies between all information that is supported and what should have actually been done. By knowing the right practices and eliminating errors with better technology, discrepancies can be kept to a minimum. Perform a self-audit. Perform your own random mock audits based on the same criteria as a Medicare auditor to uncover what they would find before they show up at your door. While there isn't an exact method of determining what an auditor would find, there are a few things that can be done to create a checklist of sorts. Visit the CMS website for the most up-to-date information on submitting claims that comply with Medicare guidelines. Review every process. Reviewing every process pertinent to the medical billing and patient information systems side of your medical practice is important in preventing CMS audits. As medical billing and patient information systems become more integrated, the need to review every process becomes more critical since a simple change could require an organization to upgrade multiple other systems to be successful. This also happens when regulations change. If the coding of a specific medical procedure changes, every system that uses those codes needs to be examined to make sure that it can handle that change. Train your staff. One of the most common reasons a healthcare organization fails an audit is human error. This is where a well-trained and experienced billing team can be considered the most important driver of revenue for medical practices. Billers and coders who are credentialed and certified from the proper associations are less likely to make mistakes and understand how to properly manage these solutions. A qualified and confident staff is also more likely to be aware of industry changes that impact operations and can implement changes to remain up to date. This kind of staff is also more likely to advance principles that can make a bigger difference in the revenue cycle. Thank you for your time. Contact us to collaborate on our email info@rsbhealthcareconsulting.com or our website www.rsbhealthcareconsulting.com.